when the nurse brought her to me, I think it took me a minute to process.
特别愧疚，就是不知道做错了什么，哪里做错了。
In China, about 2,500 children are born each year with microtia, a congenital condition where the outer ear does not fully develop. While most maintain normal hearing, their visibly different appearance often becomes a lifelong emotional burden, influencing their journey in profound ways.
小朋友就会问他，追着问你的耳朵怎么这么小？我就说这种事情怎么会发生在我身上？
他就会问妈妈，我什么时候这边的耳朵可以长出来呀？一直就关注这个问题嘛，就感觉很漫长。
Chinese we said 小耳朵 it means the ear is too small and compared with the normal side. Most of the just a mono side. Someone that have 2 ear have problem. Most of the 95% of the just 1 ear have problem. Compared with the normal one, this ear too small and looks not normal.
Though young kids may not yet understand their uniqueness, the weight of this difference often falls heaviest on the mothers who brought them into this world.
就当我生下他的时候，一家人都崩溃了，就慢慢熬吧。反正整个月子期间都是一直在流眼泪的，然后就这么多年一直都是很愧疚的，所以就拼了命的打工，就一切都为了他好，就想把他的耳朵给治好。最难受，万一他以后听不见怎么办？
之前他就会问妈妈，我什么时候这边的耳朵可以长出来呀？我们当时去办身份证的时候就要露出来嘛，然后当时人家说了，然后他可能心里就有点不太那个。
The most widely adopted reconstructive method involves harvesting the patient's rib cartilage, sculpting it into an auricular framework, and implementing it beneath the skin. The optimal timing for this delicate surgery falls between the ages of 7 and 11.
So is there anything that here the Chinese doctors may have a better advantage compared to American doctors or?
One of the big factors that we decided to do surgery here is, being here, seeing all other patients just like her. That's something we didn't see in the U.S. I mean, we went to see many doctors in the U.S. For them, it's very rare to see, a kid like her. I mean, the doctor told us they only see someone like her like once a month, and that was it. Yeah, but then the doctor we visit here, I mean, even like in Shanghai or Beijing, those public hospitals, they have, when we went there, was lots of kids outside the room just like her. And when we came here, it was like they have several floors, room full of kids just like her going through the same thing. So that made my husband much more comfortable to do the surgery here. It took a little convincing for him to do it, he's American, grew up there, and they do have good technology there, top-notch surgeons over there in the U.S. So he preferred to find someone there, and being here, he does not speak the language. He kind of had to rely on me to translate everything, and he doesn't really know what's going on sometimes. So yeah, but when we came here to visit last year, October, and that visit totally changed his mind. Before coming here, I had a list of questions, like 10 questions on my phone, wanted to ask the doctor. He pretty much answered all the questions during the presentation, which I've never met any doctor, approach. Yeah,
very
that
assuring answer.
Yes, so that was kind of convinced him as well. Right off the bat, he gave us like very detailed through information about microtia and the procedure. In some cases he did, like other kids, we saw the result pictures and all that. And then afterwards we met with him in person, one-on-one, and he took us seriously. He was very kind, approachable, and really talking to us. Felt like he sees us and hears us. So just one visit here, we decided to do the surgery here.
Traditional ear reconstruction involves a 3-stage process spanning at least 11 months. Now, pioneering Chinese surgeons have revolutionized the approach, achieving equally perfect outcomes with just 2 procedures, effectively halving treatment duration.
Oh, in the phase 1, that's a small surgery or small procedure. Usually we take like 10 minutes, 20 minutes for the surgery. We have to cut a small incision on the head, and we dissect the skin, and we put the tissue expander at the back of the silicone. And we put it in and suture the tissue. That's it. That's usually they stay in the hospital just for 4 days. Then go home and inject for them by mom for 3 or 4 months.
And that's why we see here in this hospital children with swollen ears here on either side.
Yeah, that's very similar to the mama have a baby. When the baby grew, mama's abdomen become big and big. It's quite similar.
Is it a gradual process, the size of this expander?
Yeah, they inject the normal saline every day, once just 1 or 2 cc, so no pain. Then slowly the tissue grown and have enough tissue, enough skin for me for the second stage to cover my framework, front and back.
So the children will wait for 3 months with the expander in their head?
Yeah, there's a ball over here. Even they go to school, most of them go to school, the classmates find they have the bone here, and in the beginning small and then become big and big.
Some sort of magic is going on.
Yeah.
The critical stage of microtia reconstruction lies in phase 2. Crafting the ear's complex 3-dimensional structure requires sub-millimeter precision, merging surgical mastery with an artist's eye for form. Today, China's pioneering surgeons stand at the forefront of this transformative field, setting global benchmarks in expertise and outcomes.
What about the second phase? That's the most challenging part. It really involves a lot of medical procedure as well as arts.
Yeah, in the second stage, we remove the tissue expander. We have small incision and take it out, and so we have the pocket. We have the tissue over there. But I have the thin net. The cut-offs on the tissue lets the skin become thinner. The thinner the contour is better. And then I have the cartilage. And of course, that's my colleagues. They help me do that when I remove the tissue expander. And after remove tissue, I already have the cartilage. So I cut the cartilage and then put them together. We copied, another year. The similar, the better, So we have the framework. And then I put the framework into the pocket and search the, incision. And they have the suction drain. You can finally have new ear. Every test is a challenge, They have the different, cartilage quality and quantity. And also skin thickness different. And also, age are different, a lot of things different. And also, every day, I try to improve my technique. I always find that, something is not good. Let's try to change it. That's something, why I have such good result. I always told me something wrong. You have to find some new way to solve that problem. That took me a long time, like more than 30 years, almost 40 years. To improve and this technique. Mom and dad stayed on the outside of the OR. They look forward to have the good result.
They have high expectations.
Yes.
And you could make no mistake because this
You
is
cannot,
not.
You cannot. You must have worked hard and try your best to have the good result. The oldest one is 69. You know why?
Why would that patient decide to come to you at that age?
He went to the kindergarten with his grandson. a grandson said, if you had just 1 year, I don't want to go with you. So he said, I want to have the new year just for my grandson.
So people are thinking about completeness.
Yeah. The people think that everyone wants perfect, have 1 year is not perfect. Most people, believe that's not perfect. They want perfect. In fact, 1 year is enough to listen.
Right.
From the conversation, 1 year is absolutely enough. But why people have 2 years? Because you have 2 years, other people have 2 years. They also want to have 2 years. We just want to say.
Medically speaking, 1 ear is sufficient to pick up sounds, yet we refuse to settle for anything less than the whole. It means more than just functional adequacy. It holds a profound reverence for the interconnectedness and integrity of life.
我就感觉我这那么多年的一个就是心事儿哈，就终于可以放下了。感觉从出生一直就关注这个问题嘛，就感觉很漫长。真正要来的那天，就是内心就是又激动又害怕的那种。当时他推出来那一刻哈，我就感觉哎呦，给我的就是一个莫大的惊喜一样，就看见他的耳朵，我感觉就是比我预期的要做的还要好。终于就是首先可以留长发，之前他都是留的那种像我一样的头发，然后可以遮住耳朵的，然后我们以后就可以编好看的辫子。
妈妈这边就给编得很好看。
看它变好，然后到时候拔了管子以后回家慢慢休养。
现在这医疗技术这么发达了，我真的做梦都没有想到这么早能把手术做好。他好好学习，然后身体健健康康就好了。
We also talked to some mothers and children. Some mothers were extremely happy, and others were in tears. They were trying to hold back their tears, happy tears, of course.
That's something. That's why I still, spend 6 to 8 hours in the OR. In my age, most doctors they just begin to enjoy the life. They play golf or have to traveling but I still spend a lot of time because this surgery is a really reward. When you look at the result after surgery, mama are very happy, and when mama happy, you look at the kids, they are very happy.
So have you talked to children who woke up from the surgery, phase 2 of the surgery, meaning that they have got their ears, when they looked in the mirror, what would be their reaction?
Yeah, they're very happy, They believe now they are normal. Before the surgery, they just had 1 year. Now they have 2. They said, everyone have 2, just I have 1, now I have 2. So they are real happy.
Some children try to hide their ears, the deformed ears with their hair. Some wanted to do things that they couldn't.
Yeah. It's because when they go outside, or someone stare on their ear and ask the question, why you have such a problem, they feel not very bad. So sometimes they cover that. But I encourage them to just show that to the people because it's difficult to count. Even the long hair. Why this side have long hair, why another side short, The psychological effect is not good for the kids, So I also encourage mom, you should be brave enough to take your baby go outside. Just imagine, it's difficult for them. Very difficult.
And a lot of kids are surprised to find out that they have so many little friends who have the same condition here at the hospital. Because, as they grow up, they have very little friends. And all of a sudden they're surrounded by kids just like them.
Yeah, this disease is not common. But when they go to a hospital to find a lot of kids, here, and they are same. So they are happy, They say, oh, not only me. A lot of people have the same problem. And also they can have a new year, I can have a new year.
And it's probably the same for mothers. They take the blame for themselves.
Yeah,
and they feel isolated.
They feel alone. That's only me have such a problem, I do something wrong. Why just my baby have 1 year? Other people do have 2 years. But when they come to see me, they found I have a lot of such kind of patients, They're totally relieved. They do not like to talk with other normal people about the year of the baby, but they want to talk to each other. They, change the information and to share the information. After surgery, they keep the contact.
They develop this emotional bond as they have this shared condition.
We call the WeChat. They talk to each other. They have we call the 群. I'd say the 群.
The group chats.
Yeah,
moms
chat.
help moms.
Yeah.
For many children, this might be their first surgery, an operation that may take just an hour, yet remaps the way they encounter the world. When the absence is finally filled, what returns is more than an ear. It's stolen laughter, the unguarded joy of childhood restored. Medical progress advances in millimeters, small steps, profound leaps.
我想要留个很长的头发，留到我的脚那里，因为我感觉长头发好看一些，还可以扎很多漂亮的发型什么的。
表面上看起来是一个很调皮的，实际上他也会，就当同学问到他的时候，他就有一点回家，他就会在我们面前说，甚至会掉眼泪。上幼儿园的时候，可能小朋友都年纪小，他们比较好奇，就会问他，追着问你的耳朵怎么是这样一个小，怎么这么小？他当时也不知道怎么解释了，他就说你去问我妈吧。他那个同学看到我了，那就真的跑过来问，我就说天生的。其实这样问就像用针在扎我一样。看到他自己出来也。笑眯眯的哈，我也挺放心的。当时看到耳朵特别的满意。
牧羊，你以后有什么心愿？
我想去各种地方旅行，最近想去海边去来一次真正的赶海。不过现在不可以，因为耳朵不可以碰水。
还有多长时间不能碰水？
拆线完了以后就可以了。半年以后来那个复查。然后到时候再考虑要不要在那个有时候耳朵上还有点毛发啥的，要不要脱毛就行了。
那就祝你早日把这个小耳朵的线拆了，然后把这个管子都拿掉，漂漂亮亮的留一头长发，
行吗？
好吗？
你说谢谢。
谢谢。The new part of your body, do you like it?
Yes.
You're gonna have long, pretty hair very soon. How long would you like your hair to be?
This long?
This long?
Remember you told mommy you want your ear pierced, you want new sunglasses. Wait, are those secrets? Is that okay if I share? Okay. So she wanted to wear sunglasses, get your ear pierced. Oh, wait, maybe clip-ons. I don't know.
Clip-ons,
Yeah.
Do you have advice for, parents who may go through the same experience as you did?
I guess some other advice is don't worry too much. When I had her, right after I gave birth in that time, I don't know what's going on with her. And sometimes tend to have a little depression postpartum, so I feel like really just don't think too much and focus on positive things and just live your day by day and you'll get there.
Yeah. And she will be able to explore a whole lot more things.
And
you're also a brave mom.
Thank you.
So by carving the cartilage, you are not only crafting a new organ, but also perhaps the future, drawing the future.
Yeah, I know that the whole family, rely on that this small surgery, especially the baby's, this boy or girl's life, whole life. If they have a good result, they go to outside and to show their classmates and look at, I have 2 years. You guys have 2, and now I have 2. They are very happy. And the parents, can take the baby boy and go outside, the children to outside to show the people, they become normal. Before the surgery, they're abnormal. They feel good, they feel, not good, and now they feel we are normal. They're happy. So that's something really important for the surgeon. That's why, I spend a lot of time at OR. That's not creating a new year, it's creating a new life, creating a happiness.
As medical expertise advances, patients now cross continents from North America, Europe, and Africa to seek treatment in China. A rising number of international patients are placing their trust in the capable hands of Chinese surgeons.
What is the advantage of Chinese doctors in treating this disease?
First one is the result. This technique is much better than the traditional technique. Conventional technique is have the skin graft, and the color is not good, much more scar, surgery time is long. Our technique, time is short, less bleeding, less time for the anesthesia, so that means less risk, and also we have much better result for less cost, better result. So that's why the people from the whole world come to see us. They compare with us other doctors' result. So more and more doctors now adopt our technique. They believe. In the beginning, they don't believe it. You Chinese. In the beginning, we are developing country. Usually, we learn from the West. Developing country. They, usually they first have the good technique. Nowadays, more and more Chinese have the really good technique, so we can teach them. We can share with them. Like 20 or 30 or 40 years ago, we just learned from all our medicine. Nowadays, except the traditional China medicine, we learn from the West doctors. But nowadays, it's time for us to contribute to our medical society.
Now, internationally, where does China stand right now in terms of the technology and the technique of the ear reconstruction surgery?
We are the best one because I give the lectures in America, in Europe, in Japan, in all world. We have the international conference. We compare with each other. These techniques with tissue expansion techniques, the best one.
Now, increasingly, there are patients coming to China seeking medical help from all around the country. Do you have international patients?
Yes, of course. We have some patients come from America, from Denmark, from Europe, and from Africa. Yeah, more and more foreign patients come see, do the surgery in our hospital. I teach a lot of young doctors, and also about the 10 of doctors learn from me to now do the ear reconstruction. I have the foreign training, young doctors, resident come from New Zealand. Now, no doctor in New Zealand can do ear reconstruction. He said he wants to go back and do ear reconstruction for the people of New Zealand.
Look back now, how long has the history been in ear reconstruction? And since when has China started developing this technology?
I believe Chinese doctors do ear reconstruction began in like 1950. First generation doctors go to America in the late of 1940 and come back to China in 1950. They practice in China to do a ear reconstruction, but the result is really poor. It lasts like 20 or 30 years until the late of 1980 to early of the 1990. In that time, the tissue expansion technique, we learned from America. It's American technique. And we put them together. We are the first one to use tissue expansion technique to do ear reconstruction. We do a lot of tissue expansion surgery in China. We have a lot of burns, scar, and needles, G9 needles. We use the tissue expansion technique for a long time. So I have a lot of the experience in tissue expansion technique. Then I transfer to the ear reconstruction.
One of the reasons that overseas patients choose to come to China seeking medical help is the fact that they think Chinese doctors, surgeons especially, have dealt with a great number of cases.
That's true. China has a lot of people, so we have a lot of patients. Our surgery is 10 times than American European doctors. I know that a very famous European doctor, he write books to tell us that in 30 years they do the 2,500 cases. I just the one year can more than 1,000 cases.
Wow.
So we have a lot of patients here, so we can practice and practice and practice, so we have much better result.
And practice makes perfect.
Yeah.
Looking ahead now, how do you envision cooperation between Chinese doctors and your international counterparts in trying to further develop the ear reconstruction surgery?
Every 2 years, we have the International Conference of Ear Reconstruction. All the doctors in the whole world, they do ear reconstruction. They go to one city, and we talk to each other. We show our slides. Sometimes we have the demonstration of surgery. So we learn from each other. That's something different from the other science and the technique. No patent.
No patent.
For the surgery. So the only thing we can do is share with each other and respect each other. So we share the technique. And also we write papers, publish in the Journal of Plastic Surgery, and we write books. You know, I read the foreign doctor books, and I will write the books in the future and in English, and to show my technique to them. That's why we can learn to each other.
In 2021, President Xi Jinping proposed building a global community of health for all at the Global Health Summit, a vision Chinese doctors stand firmly behind. They believe medical progress should never be confined by borders, whether sharing critical data, conducting joint research, delivering cross-border medical aid, or nurturing global talent. China is proving that healthcare isn't a solo race, but a marathon we run together. In medicine, there are no borders, only healing that bridges mountains and seas.